be okay with it. And so now we're going to move to the part of the meeting where we're going to talk about our work in progress. As I said at the beginning, we're just starting the third year of our 3-year community health improvement plan. And so today we wanted to give you a little bit of a sense of what happened for us in 2022, year 2, and what we feel like we've accomplished. And I've been working for a while now on reaching out to lots of our partners and partner agencies to get a sense of what they've been doing on the strategies that were in our plan. And I've collected a bunch of information. We're going to share some highlights today. So first, I thought that I would remind you about, we could go back to year 1. So using our sort of social media inspired meme format, we're going to think about how it started in the first year of our CHIP. We were just coming out of the state of emergency in the pandemic. And really, we spent a lot of time in 2021 pivoting. We spent a lot of time on Zoom. And for this presentation, I used Phoebe's excellent folder full of pictures of Zoom screens. And to illustrate that, we worked with our steering committee to really develop it and define its role as we head into what is like the 7th year of CHIPS in Franklin County, North Quabbin. We worked really hard on figuring out how to include priority perspectives in our work. We started working very intentionally on building our legislative advocacy skills. And it was a good year. Our first year was a good year, but it was a little bit kind of hunkered down, planning, thinking, retooling. And in comparison, here's how it's going in year 2. Year 2 to me feels like this is the year that we really busted out and got to work. And so I chose some pictures to illustrate that of us out on the streets, rallying, visiting the new family medical residents from Bay State Franklin on their tour of Franklin County, visiting Elizabeth Quirk, us presenting in Spencer at a conference for the Community Health and Healthy Aging Funds grantees, CTC having its 20th anniversary celebration over at Hawks and Reed, and so much more. There were so many fond memories of things that we did this year that were active, reconnecting, kind of rebuilding the networks that we had, and also connecting with people in person who we had only seen on screens. So here's a second page, which kind of, I'm trying to capture that sense of the pandemic experience taught us how to do things in a lot of new ways. And some of the things that we learned, we've stayed with. We realized, you know, we can take students' work out of schools. If it's hard for us to get into schools, we can take students' work, like the Advancing Racial Justice in Schools project did, and put it on the Greenfield Common. We can go to libraries and do Narcan trainings. We can make videos that show people what community resources and agencies are like the peer ambassadors did this year. We got back into classrooms this year. We started working more actively with folks in West County who help people. There's a picture of a meeting of the West County People Helping People group at the Buckland Recreation, at the Buckland Pool, I think. We published newsletters, paper newsletters, and online newsletters, and we kept meeting on Zoom, just like we have been before. And I think we probably will continue meeting on Zoom, because one of the things that we learned is that for some purposes, meeting this way online can be really great. So I also wanted to invite Gina Gavoni to talk a little bit about some of the new opportunities. I think she's going to talk about the housing related opportunities, and then I'm going to talk about some of the other things that have come up. this is just a sampling. It was kind of an incredible year in terms of unanticipated opportunities. And some of them were born out of the pandemic. You know, there was a lot of funding that came from ARPA and other things. We have chances to be able to do a lot of work that we hadn't imagined when we made our original plan. So Gina is a member of our steering committee and also the executive director of the Franklin County Housing and Redevelopment Authority. And I invited her to talk a little bit today about some of the housing changes that are happening.
Thank you, Jen. I want to first just thank you and Phoebe for this wonderful opportunity and perspective. Just looking back on our work and being able to sort of sit here and say, wow, we have done a lot. And things have shifted, and it is no accident. It is because of this work. So thank you all, really, because it is a group really working on this. In our part, we had the fantastic opportunity. Thank you, Senator Comerford, for her advocacy and allowing us to get at Rural Development Inc. in particular a set aside of ARPA funds that allowed us to build our housing development capacity. And that has really allowed us to be in a formative role working alongside CSO in the expansion of the homeless shelter that will now include 36 units of permanent supportive housing. I think one of the things that we've all learned here, and one of the things I really value with the CHIP is the understanding that housing really is part of the solution, but also that there is not one sort of one size fits all housing for everybody, and there is a real need for affordability, accessibility, and supports. And that is really what's needed in this community more than anything. And I think we've been able to really work with CSO we're so pleased that they're going to be leading this expansion effort and also managing these housing units, including accessibility on all sides and some wonderful services. And that's just a very small part of all of what CHIP is doing. So I'm going to turn it over to Jen to talk about some of the other opportunities in 2022.
So some other things that came up were support from the Department of Public Health in the form of public health excellence grants that are now bringing funding to every municipality in Franklin County, which means that we are working with every health agent, every board of health, and through the Rural Vaccine Equity Initiative, which is part of the Office of Rural Health, we are also working with community-based organizations like the Mary Lyons Foundation. I saw Kristen come in, and Mohawk Regional School District, Montague Catholic Social Ministries, and we did a project with the FRTA, and that work will continue. Also this year, Bay State Franklin Medical Center awarded a new round of Better Together grants. The Opioid Task Force kicked off the next wave of the Healing Communities study, and CSO was designated as the region's community behavioral health center, in addition to the changes that they're making in terms of providing shelter services that are coming in 2023. And that's really just the tip of the iceberg. There's so much happening. I just wanted to highlight a few things. And part of the reason why I wanted to highlight those things is because in some ways, there's been so much new and so many opportunities that when it became time for me to go back and look at the 3-year plan that we made in 2020 before and at the very beginning of the pandemic, it's hard not to be distracted by all the newness, right? And all the opportunities. But I do want to tell you that it has been a great gift to be able to spend the last couple of months talking to people about the specific strategies that we said, these are things we're going to do between 2021 and 2023, and to hear about how those things had gone. Some of them have gone exactly the way that we planned, and some of them have gone very differently. And I have learned so much from this process that I felt like I couldn't share it all with you today. It's a little overwhelming. So I think that, we'll be kind of gradually reporting on our progress over the whole course of the next year to you. But today, what I wanted to do was to really invite a few of our CHIP superstars, I'm calling them, to highlight some things that happened that this past year that are really great. But to frame that, I'm going to begin by saying, the 3-year plan that we made, which we've updated, and I put the cover of the booklet on the slide here, and we put the link to it in the chat. So if you want to look at what were the objectives? What are the strategies? What's the whole big picture of this plan? That's all there for you to look at. But there are 3 big goals, and each of those goals has objectives connected to it. And the objectives all have strategies connected to them. So the goals are about high priority community health concerns that were identified in the CHNA from 2019. And those health concerns were type 2 diabetes, age at first use of addictive substances, and symptoms of anxiety and depression. And that's the structure that our working groups flow from for the CHIP. So now what I'm going to do is I'm going to turn it over to Rachel Stoller, who has been the co-chair of our Healthy Eating Active Living group, in addition to coordinating Mass in Motion and co-coordinating the Communities That Care Coalition. And this year in 2022, serving on the Montague Board of Health. She's going to tell you a little bit about what this group's accomplishments are, and then she's going to introduce one of our working group members and colleagues, Megan Rhodes.
Thank you, Jen. I need to turn on my light because you can't see me. So the Healthy Eating Active Living group, which was formerly called the Type 2 Diabetes Work Group, and we decided that we wanted to focus, including in the name, we wanted to focus on the community level protective factors that actually work to prevent type 2 diabetes. So those are healthy eating and active living. So this CHIP group focuses on reducing barriers that prevent people from taking action that will lower their risk of or the risks associated with type 2 diabetes. And the strategies we selected for the 2021 to 2023 plan are being implemented by the FERCOG's Transportation and Land Use Planning Department, Mass in Motion, Age Friendly Franklin County, the Franklin County YMCA, Life Paths Healthy Living Program, and Food and Justice and Systems Change initiatives throughout the region. One accomplishment that we have to report is that the Complete Streets program has now provided 8 municipalities with nearly $4 million to make improvements to sidewalks, crosswalks, bus stops, bike lanes, etc. We had hoped to get to $3 million by 2023, so we're already over that. And by we, I mean this is mostly the work of the FERCOG's Transportation and Land Use Planning Department and the towns themselves, because the towns have to establish the Complete Streets policy, and they have to participate in the prioritization planning, and they have to apply to the state for funding for their projects. And there's still room for improvement because there are still 15 towns in Franklin County that could potentially sign Complete Streets policies and implement prioritization plans and apply for funding. So there is work to be done. So we're hoping to see in the next year more towns establish Complete Streets policies. And now I'm going to pass it to my colleague, Megan, who will give a brief overview of the Regional Transportation Plan update and ways to get involved with that. And then Megan will have us take a break.
Great, thank you, Rachel. Yeah, so I am representing the FERCOG's Transportation Planning Department. We are currently undergoing an update to our Regional Transportation Plan. I think everyone here knows how significant transportation is to affecting people's health, whether it's being able to walk safely or get to your doctor's appointment. It affects all facets of people's lives. And so this plan is pretty important for that, because not only do we look at all modes of transportation, we're looking at it at horizon for the next 25 years. What are going to be the region's priorities for the next 25 years? And that helps shapes our priorities, our goals, and also our funding for projects in the future. So what we're doing right now is we're in a public input phase. We're gathering as much information as we can from the public in terms of what do they think we need in the region. Do we need more sidewalks? Do we need more frequent bus services? Which roads are safe or unsafe? And so we're in the phase right now of gathering information through attending meetings like this, stakeholder meetings. We have a survey that's available on our website. We also have an interactive map, which I will demo in a little bit and ask you to play with. And then we're also going to be having a public meeting on February 15th in the evening. That information is up on our website for you to view. I am going to share my screen real briefly to show you what we have going on. So on our website, the FERCog's website, which as Jen pointed out is going to be changing a little bit, but you'll be able to find it under our transportation planning page, is this story map which we've created, which provides a kind of interactive overview of what we've been doing, what this plan is. There's a lot of things you can click on and kind of at a snapshot glance see what's been happening. For example, you can see some of our projects that we're proud to say that we've done and helped get underway here in Franklin County. Here's the General Pierce Bridge under construction and after, which soon will be opened up. Some more, I know Rachel's very excited. The French King Bridge, there's new construction on that. Some suicide barriers are going in there, which is an important element of safety there. And then a much needed FRTA maintenance garage is currently under construction. Here you can see what it's going to be looking like. So we've got a lot of projects and they cover a whole lot of different things, whether it's transit, walking, biking, roads, bridges, just basic infrastructure. We've been doing a lot. And so we want to also hear what more we can do. So on our website, let's see, I stopped share. Let me share again for a different thing.
I put the survey link in the chat, Megan.
Okay, yep. So there's an actual survey that we are going to be doing, a Survey Monkey that we'd love to have you guys fill out and spread the word. Please spread the word. Everyone you know fill it out. But we also have a interactive map. Let me go to that now and share. Okay, so there. So if you go to our website, and I think Jen was going to put the link in the chat, we have this interactive map. If you click on that link, you'll see this. You want to proceed as a guest. And what's going to pop up is a map of Franklin County. And on this map, you can add a point if you think there is a problem spot, if you think that there is a intersection that's unsafe, if you think that there's a sidewalk that needs to be added or fixed, if you think there needs to be a crosswalk someplace, let us know. Here's where you can zoom in, you can pan around, and on the side here is where you can add points. So say I want to submit a comment, you can, fill out the information as to what it is. Does it relate to walking, driving, biking, the type of categories? You can add pictures. You can use your phone. You can, when you're driving around or walking around, you see something and you want to say, hey, I'd love for the COG planners to know about this. Feel free to add a picture. And then you can, if you click on somewhere on the map, you can click to add a point, and that'll be, once you hit report, it'll be in our archives and we'll be able to understand where things are needed in Franklin County and what type of projects. So I'm happy to answer any questions. That's the real quick overview. But we have a few more minutes. So what we're going to do, I think, is Jen has the link in the chat. I would love for you guys to take a break, about a 10-minute break. Be back at 3:45 if you want to walk, stretch, go to the bathroom real quick, or fill out this map.
Or the survey.
Or the survey. Either way, you got plenty of time. And if we want to, Phoebe, do you want to come back a little earlier than 3:45?
think that's fine.
Okay. So in the meantime, I'm also here. Feel free to ask any questions about transportation in general or specifically. I'd be happy to answer them.
I know this weekend, one of my kids was saying a particular place that he thinks is very dangerous to turn on from Country Club Road onto Silver Street in Greenfield. And
Yes.
I can't wait to tell him that he can go to this map and make his comment, and it will end up in the regional transportation plan discussion.
Absolutely. That's the type we're looking for. Intersections that are unsafe. You know, if you're walking and you need more lighting, that's things like that. Also, transportation encompasses a lot of things. Rail, it encompasses hiking, anything that moves people or things is considered transportation. And we are going to also be at the Franklin County Resource Network meeting to talk about this and get input next week. I think it's next week. Remind me my schedule.
I think it's February
Is
2nd.
it? Oh, you're right. You're right. February 2nd, we'll be at the Franklin County Resource Network to also gather information from different perspectives. So we'll be there. If you're also going to be attending that and you've got some questions that come up after that, we'll be there to discuss and answer.
Will we be able to update what we put on the map later? Say add a picture later?
Yes, you always just add another point on top of the other point with a picture. We'll know what you're talking about.
Okay.
And I think for people like, this technology might not be something that works for everybody. And I know that there was a question in the survey when I filled it out that asked me to name places that I thought that I avoided because I thought they felt dangerous to me. And also I know that everyone in our planning department is really nice and really interested in hearing your input and would be happy to get it anyway on the phone, by email. This process is going to go I think until about the middle of March.
Yep. So
things
we're
are
going to be doing
open.
public comment through the end of March, at which we'll be drafting the plan. It's going to be a draft will be finalized by the end of May, and the plan itself will be finished by July.
Kate has a question.
Go ahead.
Megan, I've got a question about if there's already a notice, actually there's two. It's the connection between Turner's Falls and Greenfield. That's sufficient, right? I don't have to add a third comment that there needs to be safer walking.
If you want to, feel free, because it just bolsters the case, but I will write it down because that certainly is a pet project that we know needs to happen, but I will note that.
Okay.
I think to point out, it could be helpful to Megan to be able to also show a whole bunch of little dots in the same place saying, look, we went to the public and the public all said, how come you don't have sidewalks between, Turner's and Greenfield? So feel free to add, even if they're already there.
Absolutely.
Thanks.
All right. So everyone is going to give input, right? These only happen. How frequently do these happen, Megan?
So it happens every 4 years.
Okay. All right. I don't see a lot of people going to the bathroom, so I think maybe we should keep going. Also we will send out to all of you the link to the map, the link to the survey, the link to the register for the public meeting and all of that. But I think given that I'm still seeing a lot of faces, I think we should not wait another whole 5 minutes and assume that people are okay with that. Yes, but Elizabeth has a question. Yep.
More requests for permission on something. I'd like to share a story involving a need for sidewalks. And since there are people who are able to secure such funding on the call right now, may I please share a quick story?
Of course.
Go ahead, Elizabeth.
Elizabeth, if you're talking, we can't hear you. There we go.
Okay. I had to get to the pharmacy and my prescription had not come in until after the buses were no longer running. I had to walk from Leiden Woods, which is an area that does not have sidewalks going pretty much anywhere, to the pharmacy and back. I was fortunate to be able to do this. I was fortunate to be able to do it twice, since the first attempt got me there after the pharmacy closed, but it was raining the second time, with no sidewalks except for a few little interesting places, including by the Green River swimming hole, which I found out after dark in the mud that if you follow where it says that there's a sidewalk that disintegrates into something that would be dirt, I suppose, if it were not raining, and required that we cross the street into what turned out to be a really deep mud puddle that soaked into my boot. This is the first time I've been able to walk that far in literally decades, and I'm now having to do it barefoot because I had muddy, rocky boots. This is a really long walk. Hardly any sidewalks the whole way. One impolite driver apparently thought that it was amusing to clip as close as possible, even kind of slightly swerving off the road to go towards a pedestrian out walking in the rain. I had to get to the pharmacy, though. There was no public transportation at that hour, and the sidewalks were full of mud. This was not okay. Please, a lot of us living out in Leiden Woods do not have cars. This is subsidized housing, and it's dangerous, especially for people who are pushing baby carriages in that. I can't imagine if I had a little kid needed to bring a stroller in the mud, in the rain, to the pharmacy with me. I can't imagine that. It was bad enough that I barely made it, and it was medically necessary. Please get us some funding for these. Thank you.
Thank you, Elizabeth. It's been such a priority for years, that particular stretch. I know that Megan and her team have all been working on it. Okay, we are moving on. Jen?
Yep, sorry, I hit the button a little bit prematurely. And I wanted to thank you also, Elizabeth, for reminding us of how difficult it is to get from Leiden Woods and many of the neighborhoods where people live without cars in our area. And I think that the weighing in on the regional transportation plan is something that everyone can do. It only takes a couple of minutes. And it really does make a difference. One of the things that was really interesting about the first story map website that Megan showed us, and I shared the link to it in the chat, is that it has a review of what the priorities for the last regional transportation plan update were and what's been accomplished since then. And it has pictures and a timeline, and sort of like reviewing this past year, except on a bigger scale. I found it really heartening to realize that while things happen slowly in transportation planning, they are happening, they are changing, things are getting better, and it's because of you. It's because of all of us working together to identify which things to push on, and the connections that we make with each other and the stories that we're willing to share. So with that, I'm going to make sort of a hard shift back to our CHIP plan again. This is the balance, is the things that catch our attention, that feel really urgent, and also the need to have a plan to stick with priorities that we know are important, even if they aren't feeling particularly urgent at the moment. And I'm going to ask Kat Allen, who is the co-coordinator of the Communities That Care Coalition and one of the longtime members of the CHIP steering committee, to just talk a little bit about some of the things that we've been doing in the realm of age at first use of addictive substances. And then we're going to focus on highlighting two specific strategies that have been really exciting in 2022. And we're going to have Risha Elwell talk a little bit about the Community Sports for Young People group. And I know that Risha needs to leave pretty soon after. So we're going to have her go first, and then we're going to talk about the peer ambassadors. So Kat, can you take it away from there?
Sure. Yeah. Thanks. I'm glad to be able to share. And I'm also really glad for this collaboration with the CHIP. So, when the CHIP set up priorities, and one of the priorities for improving health in the region was determined to be age at first use of addictive substances. We also recognize that there already is a coalition working on addressing youth substance use. That's the Communities That Care Coalition. And the CHIP has been very committed to not duplicating, but strengthening efforts all along. So we have sort of formed a really lovely partnership where the CHIP has supported the work of the Communities That Care Coalition, helped move it forward, helped us start some new work groups, which you'll hear Risha talk about, and helped move some of the strategies forward. So, and you can see some of the strategies that were selected as high priority by the CHIP that were also part of the Communities That Care work plan are increasing the adoption of SBIRT, screening, brief intervention, and referral to treatment in clinical settings. The Community Health Center of Franklin County is now using SBIRT with medical and dental patients of all ages, which is really wonderful. And thank you to the Community Health Center for that. We also have a new action committee that's focused on cannabis billboards. And that's meeting just for a few months to really take some concerted action at this point about this proliferation of cannabis billboards that we feel are not in adherence with the regulations put out by the state. And so we're trying to figure out what our best course of action for that is. And we also have a really great new project focused on advancing racial justice in our local school districts. And this was spotlighted at the last CHIP Network meeting, or the September one. And you can hear more about that by getting in touch with Kydra or Lee Ellen. But we're moving that forward. So Jen, do you want to talk about the okay, graph? No. So this goes to Risha. Risha will tell you about the new Community Supports for Young People work group. That's a fantastic collaboration between the CHIP, the Communities That Care Coalition, BBBS of Franklin County, Big Brothers Big Sisters, and also Community Action Youth Programs, where Risha is from.
Thanks, Kat. So about a year ago, we announced that the CTC and CHIP were going to create a new work group that would bring together several different people and several different players, agencies in our community, including young people themselves. So agencies and organizations that work with young people of all ages, 0 to 24, for some collective engagement around health equity and the overall well-being of the young people in our community. Jennifer Webster and I co-chair that group together and have been doing that for the last year, and it's been a really great experience thus far. Some of my favorite things that I've seen come out of this, or that I've enjoyed witnessing, is the number of young people who are actually involved in this work group. We have a handful of them at every meeting, and they are not afraid to tell us how they're feeling about particular things and what they would like to see change. One example that feels particularly heartwarming is that there was a young person who was sharing about a hard experience that they were having at an organization, and offering some feedback and some critique about the ways that those things were being handled. And as a result of that, the organization created a way for folks to provide feedback about their experiences that went directly to the clinic manager, allowing there to be a direct line between a client or a participant and someone who could make the change. So that was one thing that was really exciting to see come out of that. And we've also shifted the way that we are running meetings this year. We're focusing on some individual issues for each meeting, which gives us the opportunity to really dig into them and think about them as like a case study of how we want to further the conditions for young people in our community. The one that we just had in January recently, we talked about the teen space at the library that's being built, and that was a really engaging conversation between folks in the community, young people, the folks at the library, and I'm personally really excited to see how all of that comes to fruition. And our next meeting in February, we're going to be talking about Community Action's new LGBTQIA affirming drop-in space and thinking about strategies for outreach and how to bolster our engagement in those programs. So if that sounds like something you're interested in, please reach out to Jen Audley, who you all know, and she will get you connected to our group. And now I'm going to pass it on to Kaija Jacobs, who's the coordinator of the CTC's Peer Ambassador Program, and she is going to share a little bit about what they've been up to this year.
Yes, although unfortunately, unless Kydra, you've jumped on in the last couple minutes and I didn't see you, Kydra got a call from school and had to go pick up a sick kid today. So
I'm not passing it to Kydra.
I will pinch hit for Kydra. I'm also very, very, very familiar with this program.
Thanks,
yeah, thank you, Risha. So the Peer Ambassador Program is one of the new programs that I feel like that we're most excited about. We started this, it is a collaboration. There are 5 different family serving organizations involved, as well as the Community Sick Care Coalition and the CHIP. Those are the Community Action Family Center, the Brick House, Valuing Our Children, the Salison Center, as well as the Recover Project and the North Quabbin Recovery Center. So each of those agencies nominates / recruits participants from within their programs, folks who have lived experience with poverty, with recovery, with racism, with homelessness. And those folks go through a training program that was designed by some of our peer ambassadors with the help of some consultants out of Boston, get trained in best practices in positive parenting, as well as important community resources, as well as how to do outreach and talk to your peers about important subjects and things like that. So this group of 10 to 14 peer ambassadors has been active for a couple of years now. They've put in over 1,000 hours of service, volunteer service with a sort of a thank you stipend attached to it as well. They have reached more than 1,000 parents, and this is by their monthly reporting. We've done a number of projects. They have created video tours of 8 different family serving agencies so that they can introduce their peers to community services in a very visual and accessible way. You know, it's one thing to say, hey, you should go check out the Recover Project. It's another thing to see a 60-second ad, see faces that you may recognize that are smiling and so on, and get ready to go. They've also made a video promoting Family Day. They did a really wonderful Family Day event. Family Day is a day to promote spending time, quality time with your family, and offer tips and resources. And they made a great video and sent that around. The program is funded through the Opioid Task Force, as well as through the Bureau of Substance Addiction Services. A few other projects that the peer ambassadors have taken on their own. One is tabling at events in the community, although we're doing less of that than we thought we would be doing because of COVID, but we're still out there and wanting to be out there more. They've been working on helping get resource closets started at many of the at some of the local schools, getting things like hygiene products and warm clothes and so on into resource closets so that lower income students can go in and get stuff that they need without having to sort of feel ashamed and go talk to people and stuff, just very casually. So let's see, I'm going to take a quick look and see if there's anything else that I wanted to say. Oh, another piece that they are really working hard on is we have a number of family serving agencies that provide excellent, high quality, evidence-based parent education programs. And this has been set as a priority by the Community Safe Care Coalition, by the CHIP, by the Opioid Task Force. So the peer ambassadors have been working on filling every seat in those programs. So recruiting through their networks and through their outreach, recruiting folks to those. And many of the peer ambassadors have been trained as facilitators in the Strengthening Families program, or have participated in the Strengthening Families program. So that's really, or the Nurturing Families program, Parenting Journey. So that's really exciting. And we are fortunate enough to have one of our peer ambassadors here with us, Jenna Weld. Jenna, are you there? And can you say a few words about your experience as a peer ambassador, or your perspectives on the program?
I'm here. I can't guarantee that there won't be kid noise in the background. But for me, we've been doing a lot of evidence-based learning ourselves. We immerse ourselves into it as much. So when we're going out and trying to help others to see what we're doing and for the community, we can show them that they can do it too. Because we're just as much a part of the community as they are. It's been a journey for me. I've gotten to learn so much. And for me, it's always been about helping our community. Yeah. I mean, I'm here for questions. It's always hard to kind of talk on the spot.
Thank you,
so
Jenna.
much, Jenna.
Thank you, Jenna.
Jenna has reached so many parents through a lot of one-on-one, as well as, public outreach events, and just really, really appreciate your contributions.
Thanks, Kat. And thank you, Jenna, for speaking up. It's been so amazing to see the Peer Ambassadors program grow and evolve. And I remember when this idea was just like a kernel, just like a seed, and the way that it has just really grown into a real thing with these real people that I know and that I work with on CHIP work and in all these other ways is so terrific. It is the best example of having people who really are experiencing the challenges and the joys of living in Franklin County really be a part of this work. It's just been terrific. So I'm going to make the connection now to our last work group, which is also very much about peers and has a strong emphasis on local peer support organizations, works with many of the same agencies that peer ambassadors come from, and has two wonderful co-chairs who I really enjoy working with, Sandy Walters and Timothy Ranny Blake. I think Sandy's going to go first, and then Timothy's going to talk a little bit about a specific project that we've been working on.
Great. Thanks, Jen. Hi, everyone. I'm Sandy Walters, Associate VP for Community and Family Programs at CSO. I'm also on our CHIP steering committee and a co-chair for the CHIP Mental Wellness and Resilience Work Group, as Jen mentioned, with Timothy, who you'll meet next. Our work plan for 2021 through 2023 has a strong emphasis on peer support, and there is a lot of exciting developments in that area, including a Better Together grant through Bay State Franklin Medical Center. And one of our work group members, Kima Wilson, is involved in that. And there's also new opportunities for recovery coaches at the community health centers, as well as ServiceNet. Also within the new CBHC, which Jen mentioned earlier, that's at CSO, it stands for the Community Behavioral Health Center. There's also a built-in component for peers and family partners and throughout many of the services at CSO too. So just hearing the work that Kat does in combination with these peer supports, it's really exciting times. For today though, Timothy is going to talk further about something that we really dove into strongly in 21 and 22, and that is eCPR. So Timothy, you can take it over.
Good afternoon, all. Good to see you, Sandy. I
Thank you.
love these kinds of meetings because we're so always apart. We don't get the chance to see each other much. And I know that there's lots of other folks that are here too that I'm happy to know are in the room. Emotional CPR. This is something that is an exciting prospect. It talks about how all people in any situation can take on some understanding, some learning, and be able to be helpful when someone is in a mental health crisis, and be able to get them back to resilience. It's not something that is that's not the purpose so much of it, but it's a simple way to be able to connect with other people. And that's what the CPR stands for. Connect. P means empowerment, to take power, help someone else get power. And then thirdly, the R for revitalization, toward resilience. And one of the things that I'm grateful for is to see the photograph. I'm standing next to one of the people who comes to the Stone Soup Cafe where I volunteer on Saturdays. And out of a simple idea, this man was at the harvest supper. I asked if I could take a picture of him with his parrot, Ophelia. And so I made a photograph, I made a print of it, gave it to him, and it just strengthened the connection. And that's one of the things that I'm really excited about, is that there is so much that we can do in connection. And the next step is to take power in all these different ways and help people to be able to realize that we do have a reason to be under the gun, so to speak. Pardon, I didn't mean that to be politically triggering, but what I've been able to notice is that because of the cycle of the pandemic, the ways that we as a community have been affected, this is something that we can take on very clearly. And a lot of people here in the Valley have had an initial training, towards 50 people. We are all in different ways of being in the community. Some of the folks, Risha, for example, and I have connected through the fact that Community Action has brought the training in for some of its employees. There are school employees in certain places who are very interested in getting this training. And I see, again, Kat just spoke. She and Ellen have taken the training. We are all over the place, and we can continue working toward building a network of CPR trained folks. And this is one of the most effective things that we have been able to see that addresses the issues that we are facing. A lot of times I hear people say, well, what about mental health first aid? So that gives me the opportunity to speak to the differences between the two. And we usually, people who have those conversations can usually speak to how emotional CPR can be an addition, and also a different way of interacting with folks. So I'm looking forward to putting more of this training into action. And that's basically where I'm sitting at the moment in our CHIP beginning year 3, is an excited person who's looking for how to make change and make it a better place. So thanks for listening, and going to try and leave some time just so if people have comments or questions.
Thank you, Timothy. I just want to say that at the beginning of 2022, we had spent a long time thinking about what we would do to pursue this interest in increasing the capacity of people in our community to be able to support one another. And we landed on eCPR as a strategy that we were interested in, and sort of established the idea that we were going to follow that thread. And I could never have imagined that at the end of the first year, so many people from so many different walks of life connected to so many different resources would have had that experience of that initial training, which is a pretty significant commitment. And also, I have had the pleasure of being able to watch as the folks who have been part of the eCPR training have connected with each other, supported each other, learned about each other's work and affiliations, have strengthened that network. And I want to particularly mention that Kemma Wilson, who is pictured here as the other picture, has done an enormous amount of work on being really an ambassador for peer support and visiting and learning about some of the various places where peer support is happening, both formally and informally in our area. And I'm really excited that they are participating in the Better Together grant that is bringing more peer support into the emergency department at Bay State Franklin Medical Center, which was awarded by the CBAC, which is another affiliation that Timothy has. So, as we wrap up this section about, highlights and accomplishments of the CHIP, I really just want to reaffirm that, to me, the biggest accomplishment of this year is the way that we have repaired the social fabric of our lives, which had become frayed, by the pandemic and a little bit worn out, and some threads snapped. And I feel like I have this picture in my head, of the repair happening and the new threads and the reinforcement. And I feel like we are demonstrably becoming more resilient and more connected as part of this process. And I just am so grateful to have the chance to work with you all on that. And also to work with you on pushing forward to make changes at the policy level, at the state level, in laws and in regulations and in budgets that create the money that makes it possible for us to do things, which Phoebe's going to talk with us about as the last part of our meeting today.
Thank you. That was a tough speech to follow. You're so right. It's been an amazing year. So I'm here to talk about the new legislative season. One of the things we learned a lot about is legislation in our last 2 years of this session. I'm deeply grateful for both Rep. Whips and Senator Comerford joining us. They both had to leave for other Zoom things at 4, but we'll be meeting with them individually after. So to wrap it up, what are we doing legislatively? Well, first off, you should know that this is the State House image here, and the new legislative session is officially known as the 193rd General Court of the Commonwealth of Massachusetts. So that's its real name. And people who were at our CHIP priority pitch party discussion probably remember this slide that Senator Comerford provided us with that tells us about how the timeline works for legislation. Jen, you need to click. So we are in the very first blue box here, that beginning square. Lots of people in our region have been talking about what their priorities are and putting together lists of bills to inform our legislators. They all have to get filed, the bills, by Friday. And the CHIP has been doing the same thing. we learned last year that and the last session, which was the last 2 years, that we just had way too many bills on our docket. So that meant that we couldn't really keep up with the important stuff that is in those second 2 blue squares, which is getting co-sponsors, which is a huge way that a bill signals it's important, and gathering testimony for hearings. So we really wanted to thin out the list of things that we were trying to support so that we can have our voice be very clearly heard this time around. So this year we gathered people both in person and through a survey to get input on priorities, and we have a leaner, meaner list to present. And now you could show us that list. All right. So here are the initial priorities. Now, lots of things change over the course of a 2-year legislative session, so these may change, but we're hoping to make progress on these 5 bills versus the 25 from last time. Each one is addressing some kind of major determinant of health. So whether that's supporting for older adults and those with disabilities to live at home, giving young children a strong start on life, better access to transportation, access to a high quality local public health system for everyone, not just towns that prioritize it, and access to affordable housing. So I'm just going to take a minute to talk through them. Starting at the bottom, important to note that the housing priority, as it says here, is still in development. There are a number of things that were in the last session that were really important, affordable housing bills that weren't particularly rural friendly. And so we have not yet picked a bill because we need to see what the language is in the things that get submitted. And we are working with the Western Mass Network to End Homelessness and the Rural Policy Advisory Commission to understand the bills that get sent in and pick the right one to follow for Franklin County, North Quabbin. The other thing is that a lot of changes don't actually have to be legislative. You can try to change how an agency does its work, how a grant program scores grants, things like that don't require legislation, but do make a huge difference. And the Small Town Housing Working Group, which is hosted here at the FERCOG and funded out of one of the CHIPS grants, is met with Senator Comerford and created a list, and many thanks to Gina for her driving a lot of those great priorities. And that's a list that the senator and our representatives are bringing straight to the new administration. So we will really be, I think we have great hope about being able to see some changes in the things that don't take legislation as well. So moving up from that, the bill above it is the SAFE 2.0 bill, and this is a bill that we've been working on for, well, I personally have been working on for probably 15 years, some version of it, but in particular in the last 3 years, really trying to push Massachusetts to learn from COVID and actually join the rest of the 49 states in funding and requiring equitable local public health coverage. And so shout out to the 2 health educator and public health nurse type people that are on the call here today. We need folks, well-funded epidemiologists, health educators, health agents, public health nurses in every town. And we really saw what happened when we didn't. So that's what that bill is. Next one up is Common Start, which is a whole big set of agenda items around increasing access to early education and childcare, and making sure that working families have that to rely on in a way that they can afford. It's not clear yet what bills that Common Start Coalition will be bringing in, but when they do, we will check it out. And if it works for our region, then we'll be having that bill on this list. The Regional Transit Authority Advancement Bill above that is a series of different things that are needed to help RTAs like our own FRTA prosper. Some of it has to do with how they're funded. Some of it has to do with allowing for the voices of riders in the leadership of that work statewide. Some of it has to do with the way that RTAs are judged in terms of how much fee revenue they bring in, which is of course not an equitable way to look at it. And so that's, again, this is a whole agenda, and there will be a bill that gets filed, and we will be back to you with what that bill is and what it says, assuming that it works for the FRTA. And then finally, the spouses as caregivers bill is something that's been introduced by Senator Comerford in the last 2 sessions. And we think that there is a real chance that it could pass this time, and which is basically something that would allow, right now, spouses can't be the caregivers of either people with disabilities or people with or older adults. And given the absolute crisis we are having in hospitalization and home health workers and nursing home crowding, this is a very important bill, and we think we have a lot to say as a rural community about it. So those are the bills. Our plan is to do like we've done in the past, but better, and meet with our legislators about these bills. We'll be back to you, asking you a little bit about what, which, if any, you'd like to get involved in. And then when there's a hearing or there's time for there to be testimony sent in, or we're going to meet with the legislator, we'll ask if you'd like to join us on any of that. So that's the plan for legislative work for this session. Are there any questions about it? Okay. Hearing none,
I guess I have a question, Phoebe. So will it be largely Jen and you tracking these bills, or are there going to be sort of subcommittees or representatives for each bill, or how will that work unfold? Just curious.
I think we will track the bills, and then if there's a group of people who have said like, oh, we definitely want to weigh in on the Common Start thing because we can see the benefits of early childhood education, then we will be like, okay, it's time for the hearing. Who wants to come? Who wants to give? I mean, if anybody else wants to be lead of tracking, please, please, no worries. But I think we want to offer that we would keep you informed about when is the right moment, and that way it's efficient for you all to get involved. That's the plan.
Good question, Kat.
Yeah.
Yeah.
All right. Great. Well,
Super. Well, let's
back to Jen, and we'll see you all on the State House stairs.
yeah, I can't wait. Actually, I think it's going to be so fun. We have a new administration. We have a bunch of different representation. We have some really terrific folks who have worked with us before and will continue. And I think we're going to get a lot done in the next couple of years at the State House. It's going to be really cool. And I just want to say, like, we're going to have a really big party when the SAFE Act finally goes through. So
yes,
that's
please.
the other thing that we'll do is we're going to advocate and we're going to celebrate, because some of these things are big, big, big wins and have taken a long time. So that's the end of our kind of planned agenda for this meeting. We do really want to stay connected with you. We will meet again as a network in March, in March. But we've got lots of other things going on, including in a couple weeks, we're going to help to bring the regional transportation plan update to the FCRN meeting. So if you're part of the FCRN and you would like to encourage people to check out the RTP, learn more about it, Megan and her colleagues will have a little bit more time to be able to walk us through that then. And then there's also that public meeting that's on February 15th. And the Community Supports for Young People group is going to be meeting in a couple weeks on February 9th. I think it's on a Tuesday, and I think that meeting is in the early afternoon that time, and that's going to be our case study that's about the Gen Q drop-in space. And the idea of the case study is that we get a whole bunch of people together who give supportive, encouraging input to somebody who comes to us with a challenge of youth engagement, and we say, here are a whole bunch of ideas for you. And then that group will meet again in March for more of a sort of what can we do as a group meeting. And that's been a really fun experience. And if you are a person who thinks of yourself as being a community member who wants to make this a better place for young people to grow up, I would love to bring you into that group. And the Healthy Eating Active Living group is going to meet also in the middle of March. And that has been a really, really, really lovely experience that combines all kinds of approaches to built environment, food justice, exercise. And we're going to learn about the new Chana that Phoebe talked about at the beginning. I'm expecting that we'll have a CHIP hosted presentation where we will roll out the Chana results from 2022. And Phoebe, is there anything else that I'm forgetting that we have planned for the next couple months already?
No, but we will be in touch explicitly about the legislative priorities.
We
in
will
the next
follow up
few
on that.
weeks. Yeah.
And that's really it. You know, Phoebe and I can stick around for the next 10 minutes if you want to have some questions and some discussion. But if you feel like you're full up of CHIP news, this ends the formal part of our meeting. And I'm going to stop sharing so I can see more people's faces.
And stop recording.
And stop recording.
Thank you guys. Bye.
Bye.